Okay, so what does recovery mean to me? Recovery to me is about hope, really. Hope that the people I work with and support gain some, I suppose, good quality of life and sort of live the life that they want to live. So I see that as been a big part of my role, working with the person to find out what their strengths are, what their interests are, and working from that perspective. And I suppose my role is minor in some ways. I suppose the person makes the decisions for themselves, and I suppose recovery is about, I suppose, taking that responsibility on and owning it, and a sense of empowerment really over their lives. I suppose historically that wouldn't have been so. But this new way of working is to encourage people to actively make decisions for themselves and continually support that. And it's not a straightforward journey either. It's going to be ups and downs, and like life really, we'll make some decisions that we're not quite happy with, and we learn from them, like we all do, and move on again. And it's about being part of that continual process, I think, for people. So I suppose we're all kind of in recovery to a certain extent, you know. We all need to be self-aware, and I think just to try and encourage that mentality as best you can is a big part of recovery. It's a part of my work, I suppose, ARI and the recovery element to that. It's an important part of my work. It links in quite strongly with the values of social work. I'm a social worker, and gives me the opportunity to practice them in a very real and vibrant way, I suppose you could say. For example, I've recently done the recovery principles facilitation training, and I suppose that gave me the opportunity to meet with service users, family members, and sort of learn together. I suppose the idea around that is that we're all kind of equal in that process, and we all bring certain experience, I suppose, to the table. And I suppose the idea behind the recovery principles training is that we will facilitate this training to professionals within mental health, and hopefully that will sort of continue to bring recovery more into the mental health service. It is happening. There's been some really great initiatives through ARI, the involvement centres and peer support workers, and lots and lots of volunteers working within the service. So I suppose it's just to continue that, and it is a new way of thinking, I suppose. So it's about being sensitive, I suppose, and patient, I suppose, around that. And change can be slow, like in anything, but it's about sort of, I suppose, helping professionals who we work with to be on that journey as well, and to sort of support workers around that. I suppose to continue to support recovery initiatives is really important. There's lots of recovery initiatives going on around the country in different places, and they can be quite diverse, I suppose, and very different. And possibly what would help is if there was a kind of a more strategic recovery strategy within our service, that people could follow, and it would be more clear maybe to services that maybe didn't have in some cases, I suppose, it's a lot around people's interest to push recovery a bit at different services, but maybe if it was standardised around the country, there might be more of an impact, a greater impact. I just think probably within the management structures of the mental health service as well, there needs to be more maybe emphasis put on recovery and the importance of recovery, both for the service users, family members, carers, and professionals working within it. And even going, as far as the Mental Health Commission as well, and the important role that they have to play within it. They have some really good papers on recovery, but maybe the monitoring of that mightn't be quite as strong. So those areas could really help. And I think just to continue to support volunteers who partake, just around, I suppose, sort of, I suppose, even just simple things like equal pay around certain work that they do, to try and sort of, I suppose, give them a greater sense of inclusion within the service as well. And I think to continue to support professionals within the service, to I suppose to support them around recovery, and to possibly even make the recovery training mandatory, so that staff kind of have to do it, and giving staff time to do it, because in some cases the time mightn't be made available for training like that. So it's about putting it, I suppose, really kind of highlighting the importance of it, that it is an integral part of our policy within mental health, and to continue to refocus it and to revisit how it's been delivered within the service, I suppose. Yeah, I think to continue to support staff around their recovery, their knowledge of recovery, so continue to provide training, regular training, and almost make the training mandatory as well, so that staff kind of have to do it, and it becomes an important part of the training curriculum. And also, I suppose that peer support workers and volunteers are valued within the service through pay and through sort of through influence within the service. So to continue to sort of promote that, and to build that relationship with service users and family members and carers, and to ensure that their voice is heard within the service, and